Well, I'm here because I love Russia. I like very much Vitaly. I like this meeting, and Vitaly kindly asked me to help him to prepare this meeting, so it's a good reason for me to come here.
This meeting is truly one of the outstanding meetings that's held every 2 to 3 years, and it brings together the leading authorities in the field. And I think at this particular meeting, we now have over 500 participants from 60 different countries. So the opportunity to exchange information is extremely valuable.
I'm here to do live surgery and give, I think, 6 lectures. Also, I have a private master class tomorrow. I'm here because of Vitaly. Vitaly invited me here.
I'm here because Dr. Vitaly Joltikov is organizing a really nice meeting every year, and he's inviting the professionals from all over the world who is giving lectures about the special issues in facial plastic and rhinoplasty. So I'm here for giving some lectures, sharing my knowledge with my colleagues.
So being here is like a stamp with the quality of the welcome and the speakers.
I'm here because of Vitaly. Vitaly invited me to this meeting. It's a very special meeting, and with an honorable faculty, and it's a pleasure to be with him with his course.
People are coming to you with the ugly nose and asking for changing to a beautiful nose. My challenging is the biggest question: what is beautiful nose? Okay, this is my biggest challenge. What is the beauty of the nose? Huh?
I think the greatest challenge that we're having in rhinoplasty is the ability to achieve what the patient wants. Most patients have very specific desires as to what their goals are, and surgeons have a large number of techniques to achieve it. So I think communication is extremely important, and also the ability to do it in a conservative way that achieves both form and function. So having an attractive nose that doesn't breathe well is not a good result. We must always achieve very functional and very aesthetic correction.
The biggest challenge in rhinoplasty is to achieve to have happy patients.
And you have to improve your knowledge about all these techniques, because all noses needs different approaches, all noses needs different small maneuvers.
The biggest challenge in rhinoplasty is to select the right patients. This is very difficult to find the right patients, because you see by the social media there are the expectations are extremely high, and a lot of these things they are telling are fairy books. If you go to the social media, to the website, I know these guys what they are doing, and it's just not true. It is done like it is just going like to a dentist or a cosmetologist, but it is something totally different. And there is a reason for that rhinoplasty from all aesthetic surgeries has the highest complication rate.
The challenge is that some of the revision cases are getting more and more difficult and more complex, and at the same time the patient's expectations are getting more involved, more in depth, and much higher expectations.
The biggest challenge in my work is selecting the correct patient for the procedure. And that takes experience, and that takes compassion. You have to understand what the patient wants and whether or not I'm able to give the patient what they want and what they need. And what I'm able to provide for them and what their expectations are have to meet, have to be congruent, have to be equal. So the biggest challenge is not the technical aspect of the work. The biggest challenge is to have an understanding and a feeling that's positive with the patient. A good surgeon, in my opinion, is someone who is compassionate, who's kind, who listens to the patient, and who has technical skill and experience to make the right decisions at the right time, and someone who is impeccably honest with the patient. The combination of compassion, skill, and integrity makes a wonderful surgeon, plastic or otherwise.
Rhinoplasty is in many ways the most difficult of all the cosmetic operations, and the most important quality is passion, because it's not easy surgery. It requires a lot of experience, and it requires a real commitment on the part of the surgeon to really be focused on details.
A good plastic surgeon is a person who's empathetic to his patients, is skilled in his surgical skills, and has a true concern about the long-term outcome of the patient's surgery.
A good plastic surgeon who is properly trained, who has experience, who pays attention to what the patient wants, who actually is able to deliver and follows up with the patients, make sure that what works, what doesn't work, and learn from every experience, good or bad, and applies all of that to the future practices and dealing with the patients.
Well, a good surgeon is someone who questions himself always about his results, who's critical about himself, and who tries always to improve until the end for him and for his patients.
First of all, you have to be a very skilled surgeon. You have to know a lot of techniques. You need good hands, but it's not enough. You need also very good aesthetic point of view. Then it's not enough. You have to be a psychiatrist at the same time. You have to understand your patient, because patients want more than surgery. Sometimes they don't need surgery. Sometimes you have to refuse your patients for their health. It's not easy job to be a plastic surgeon.
We have to be, in a way, absolutely maniac. And if we are not maniac, we cannot be a good plastic surgeon, because we are tolerating imperfections, wrong things, and this is not good. And a good plastic surgeon, beside the technical aspect, has to be also in empathy with his patients. He has to be as close as possible to the patient expectations. So, and we have to answer that. So it is both technical and psychological approach of the patients.
Of course, I think a prerequisite to be a plastic surgeon is you must be skillful. But to be a good plastic surgeon needs that you are honest, and it needs that he advises his patient and that he is able to refuse patients. If you are not a good plastic surgeon and you take every patient who just drops in the door, this is not good. You must be able to analyze the problem and then to tell the patient, well, I can do that, I understand the problem, and you should not be concentrating on money. If he takes every patient, that cannot be true. And as you know, in plastic surgery, they say 20% are patients who have a BDD, that means a body dysmorphic disorder. This is a disease that they don't see themselves correctly, and he have to try to filter out these patients.
So I have a lot of friends, Russian friends. You know, we are the neighbors. I like Russians' discipline. The first, what I like, why I really surprised, okay, in your Congress, it's a kind of high school. Bell is ringing, everybody's go out, okay, and bell is ringing, everybody's inside, okay. No, some of the Congress in Turkey, half of the people are going to the seaside, okay, half are listening to the lesson. Here you have a Congress discipline.
It's very fascinating because Russia is such a large country with so many different ethnic groups. It's very fascinating here in St. Petersburg with Vitaly to see that very large percentage of the patients don't have the big bumps that we see, let's say, in the Persian patients or in Northern Europe. This is very specific and very challenging cases, and the quality of the results are just excellent.
Well, Russian plastic surgery has improved a lot because I came here about 10 years ago and very few people were speaking English, and even if they were interested about plastic surgery, it was kind of the beginning. Now all of them are coming, attending to meeting from the beginning until the end, which is very rare in our part of Europe, in France or in the Occidental Europe. So it has improved a lot, plastic surgery here.
And I know that plastic surgery in Russia has made tremendous progress, and I'm very delighted with what I see, the results of what I see, and I think it has to do with the education of rhinoplasty efforts that we all have been putting, and it is making a difference, and it is producing the fruit that we were hoping to have.
It's only based on people that I have personally watched work, and the quality has been excellent. Of the two people whose surgery that I personally have watched and have seen the results of their surgery based on lectures and actual video of actual performance of live surgery. So I can tell you from that experience, quality is first class.
I know a lot of Russian plastic surgeons. They are my good friends, and I'm sure that Russia is the competitor with all over the world now. So I think it's improving and improving every day, and a lot of good results from Russia I see, and a lot of techniques which we are following. Russia is the success of Russian plastic surgeons.
The first time I was invited in Russia, it was in Rostov more than 10 years ago. And during these last 10 years, I could see how much the things evolved here in Russia. If I had to be operated by a Russian surgeon, I would have no problem to come and do it here.
I think Russian plastic surgery is very advanced. It's obvious from Vitaly's course that Russians' capability with rhinoplasty is up to the level of all the other top countries in the world.
I am traveling around the world. Mostly I see at least four. I am in Asia, Europe, everywhere. And this course is the best I ever have accepted. I don't know how they can organize to invite so many very famous people. I know a lot of them are really divas, and to be able to pull them to St. Petersburg, this is really a masterpiece.
It's very fascinating with this course because you ask yourself, why would 500 people descend on St. Petersburg in the middle of October for a meeting? And the answer is because it's just such a superbly organized meeting, and Vitaly is such a wonderful host.
If I have accepted to be one of the co-chair of this meeting, it's not only because of the friendship for Vitaly, who is a great surgeon and a great person, but this course has become the landmark in Russia for plastic surgery and aesthetic surgery. This course is known now all over the world for its excellence in aesthetic and plastic surgery.
The meeting has grown exponentially, and the quality of the audio-visual is wonderful. The hospitality has always been great, it is even better. And I think people should be, Russians should be proud of what is happening here, because a lot of people from different parts of the world are here and learning, and we're going to be helping the patients.
I think this course is fantastic. It has a great faculty, it's well run, the lectures are selected very carefully and they intertwine nicely with each other, and there's good camaraderie between the faculty.
I think this course is unique because it's a big meeting. It's not a small meeting, and everybody comes from all over the world. I saw participants from Africa, South Africa. I saw participants from the Asia. I saw participants from the United States, America, South America. So this is not the meeting for just Russian colleagues. This is the meeting for all over the world. And I can say that this meeting is collecting all the details about the rhinoplasty and face contouring also the same time. I think this is really important thing for Russian colleagues also and Russian plastic surgery history.
We had a meeting. We have organized preservation rhinoplasty in Rome. The second one, I have to confess, Vitaly designed better meeting than ours about the preservation. We could, because it's a very good idea. One surgeon is doing live surgery and another surgeon is doing cadaver dissection at the same time. It's very good, the people are watching that, and I'm a little jealous about this. I have to do the same, maybe a little modified, first dissection and then the live surgery. It's really good for education. I like that.
One of the top courses on rhinoplasty in the world nowadays. So that's why we cannot miss coming to this course, and we cannot miss to stay here as long as we have to stay. But it is a marathon. We have to start at 6 in the morning and we end at 9 in the evening, and we don't have time even to lunch. So, but what I think, it is really a great honor to be here and a great pleasure. It is a top level quality in the world.
I've had the privilege of being involved in courses for over 50 years. And I'm saying without bias in any way, this is truly a magnificent course. Why? Because the topics that are covered are vast, and the people that are giving them are extraordinarily experienced and extraordinarily honest. Plus, it's given mainly by physicians and surgeons from all over the world, many of whom are friends. And they know the integrity, the honesty of the work. So the course not only is expansive, but of topics, vast number of topics, but also experienced people who are honest that are giving the course. And it gives great opportunity for people to ask questions. So there is this free exchange of ideas by experienced people and the students in a vast variety of subjects. Course A+. Now where's my vodka?